I can't believe that it's now July and we're still talking about the need for a national strategy around testing. When we look at other countries that have been successful in suppressing the level of COVID-19, they have one thing in common, which is that they have a national coordinated strategy. They don't just let different regions and different states and cities figure it out on their own. They don't have different areas compete against one another for things like masks and other PPE. And I also cannot believe that we are at this point again. Back in March, you and I talked about how doctors and nurses on the front lines don't have enough masks and gowns and are begging their friends over social media in order to try to get that extra mask so that they don't get infected from their patients. I can't believe that we're facing the same situation once again. And this all comes from not having a national strategy and also, unfortunately, having this really confused and mixed messaging coming out from this White House that instead of using science and evidence to make their decisions, they're making it based on ideology and partisanship. And that politics has no role in a public health response.
Can you talk about the significance of what's happening in Florida and in the world, the largest day single spike, not only in Florida, but in the world yesterday?
Yeah, as a country right now, we are in a worse position than we were back in March. And I feel terrible saying it, but this is the truth. Back in March, we saw the number of cases skyrocketing, but it was focused on one epicenter in the New York area. Now we have multiple epicenters of outbreaks in Florida, Texas, California. Now we're seeing the Carolinas, Tennessee, Alabama, Georgia. I mean, there are many areas that are raging out of control. And unlike back in March, we don't have a shelter-in-place order. We have no political appetite, as we just heard, for anything even approaching, even requesting people to stay at home, avoiding indoor gatherings, where we're having everyone require masks. And I fear that at this point, we are not even seeing the peak of this epidemic. And we have a lot more pain and suffering and death coming our way. And against this backdrop, we're seeing these same governors and elected officials ask for schools to reopen. And they're using, I think, actually faulty arguments in so doing. The evidence is still out, and we don't know the full evidence about whether children can be just as effective vectors for transmissions as adults do. We do know that children tend to get much less sick than adults, although some children do get very ill and some children do die. And the studies that are currently being done, we're looking at examples from other countries. Other countries have been able to successfully reopen schools, but here's why. They've been able to crush the curve. They didn't just bend the curve, they crushed the curve. They reduced the level of infection to virtually zero. And at the same time, they were able to ramp up testing and really have a national strategy and clear communication. So yes, they have been able to reopen schools safely, although even in other countries, there have been outbreaks around schools too. The single most important thing, again, that we can do in order to reopen schools in the fall is to suppress the level of virus right now in the summer. And I'm afraid that we are not doing that consistently across the country by a long stretch.